again to bring back into the interview process Dr. Scott Hoffinger, pediatric orthopedic surgeon, board certified. And welcome, Dr. Hoffinger.
Hi, everybody.
And I want to welcome everybody. We have some questions here, but if you have some, I'm going to just make sure I see them online and that we can get going on that as well. And okay, so today we're going to talk about patient advocacy as well as how to manage your expectations when it comes to seeing your orthopedic surgeon, managing the expectations, how to advocate for your own health, what are the expectations, all of that. So Scott, Dr. Hoffinger, why don't you go ahead?
Well, I think, when we first talked about this topic, it's really important because we want to be a partner with you. And yeah, I know there are still surgeons out there, physicians out there, surgeons out there that aren't as warm and fuzzy. But they need to be. They need to be, especially if you're, our field, pediatric orthopedics, but orthopedic surgery. I mean, you're doing important things for people, and we should not feel put upon to involve you. It's collaborative decision making, and we're told that throughout. Even recently on some committees nationally at the Orthopedic Academy, this is collaborative decision making, and so you should ask questions. And I just think that helps both of us, because it helps me know what you're concerned about. And then because when you go home, someone always says, "Did you ask this?" And that's not the one you asked. So that's always going to happen. And so it's how to be involved as both the educated consumer and as the partner as we make decisions.
Yes. And the advocacy also, it's very important. Some people I've noticed after being in this world for over a decade, whether it was with my daughter who's broken 22 bones or with our customers, they take a back seat to their prescription, to their healing, and they, instead of asking the doctor, well, what about this or what about that, they feel that it is not, they're not in a position to ask the question. How do you feel about that? And what can somebody do who feels a little shy perhaps about asking questions and or uncomfortable asking a doctor questions?
Well, that's a great point. I think if you're uncomfortable and not sure how to ask the question, bring up what you're concerned about, because the questions really stem from, concerned about the pain. I'm worried she's going to be in a lot of pain. Mm-hmm. Instead of, what are you going to do for pain? I'm worried I'm going to miss a lot of work. How long will they be in the hospital? So if you tell us as an introduction of what you're concerned about, that will help us to make sure that we address them. And we should probably remember those, especially the second time you bring something up, to say, oh yeah, that's been a big thing for you, is wondering about the cast or wondering about traveling. Can you travel? And so these things, we have a lot of patients, but we don't have that many operations. Mm-hmm. We have a lot more patients than we have operations. And so if you're going to have surgery or something significant happened, we should be able to address your concerns. I mean, tell us
that's a great prompt. So the prompt would be, just discuss what you're worried about. It's also, as an author, sometimes I don't know what to write. I look at a blank piece of paper, but I actually start, I would like, I would like to write about blah, blah, blah. But I can't. And so I start writing about what I can't write about. And before you know it, I'm writing about it. So it's a very similar prompt. And so that's I'm worried about. So that's great. What other things can we, bring to the appointment with the doctor?
Well, I guess we're sort of jumping right into it. I guess the first things that come up when we discuss a diagnosis, and most of the time this is, let's just take a broken bone. It's broken. Mm-hmm. So broken and fractured are the same thing. Mm-hmm. So I say, don't waste one of your questions, because a lot of us have a little bit of that adult ADD. So don't waste a question on that one. So yes, they're the same thing. And so there's a break, and we're going to do this. And so at that point, a decision has been made. So it's always, are there any other options? And implied in that is, are there any other good options? We'll put a cast on. Well, do you have to? And it's like, no, I can just let it flop around. But there's
So okay, wait a minute. I got to stop you. So you really have people ask you, do you have to put a cast on?
Oh yeah.
Really?
You have to put a cast. You can't put a cast on because she's having a confirmation. And
oh my gosh. Yes.
Yeah.
Okay. Because they have a sporting event.
Yeah.
We're going fishing this weekend. Can we do it on Monday?
Yeah. Oh yeah.
Okay. All right. I'm sorry. Yes, you're right.
So,
that happens a lot. Yes.
but I'll tell you, there was a family, a young family, and they had a little baby, I think a 1-year-old who had a broken something. And they were really upset. I was saying, guys, it's going to be okay. I'll put her in a cast for a month. She's going to be good as new. I said, what? They had saved for their entire year to take a trip to Hawaii. And it was the next day. And so I put a splint on that they could travel with so they could go to Hawaii. And they said, is it going to be okay? And I said, well, it's not ideal, but it's not bad. It's not going to hurt or damage anything. And you've saved for an entire year and you can't get, so we can sort of work with you on that. So as I'm saying, so once you have a diagnosis, there's a treatment plan. And so we are going to put a cast on. It's like, are there any other options? And again, implied good options. No, it doesn't need surgery, or we're going to have to operate. Are there any other options? Or why did you make that decision? And so again, why did you make the decision? Sometimes seems challenging. And so are there any other options? Because we should always in our minds be going through risks, benefits, advantages, disadvantages, alternatives, and to be able to say, and we do this in shorthand, well, it's out of place. We're going to have to operate on it. Because if left out of place, it will heal in a bad position and you will be crooked and it won't work very well.
Right.
We short that with, you're going to need an operation. So why, or are there any other options? No, because we won't be able to get it back in the right position.
Mm-hmm.
And I usually recommend moving on to your next question, because it gets to be, well, why can't we leave it where it is? And it's like, I answered that one and it'll be crooked. It's like, well, how crooked? and I even had a case where a family said, we don't care if it's crooked. I said, yes, you do. And they said, we don't care as long as it works well. And we went through it a lot. And sure enough, 2 years later, the girl came back when she was a little bit older and said, I don't like my arm. It's crooked. I told you. But
yeah, right.
I knew that, but I still had to, they made the decision. But so when a decision has been made as far as treatment plan, are there alternatives?
Mm-hmm. Let's talk about decisions, because, and I'll share my story. So I have two regarding my daughter. One, she had, I don't know, broken 10, 11, 12 by this time. And she was early teens, 12, 13. And she was at youth group and they were playing basketball. And she said, Mom, I think I broke my finger, my little finger. I said, honey, did you know that you can actually get hurt without getting a fracture, without a broken bone? And she said, no, Mom, really, I think I said, we'll just tape it up. We're good. I mean, seriously, she had probably 12 or 13 by this time, about the same amount as her age. Well, sure enough, when the swelling went down, and probably 10 days later, her finger was literally like almost like a Z. It was so bad. And so that was my mistake, that I didn't take her word for it, number one, and go get checked, particularly with her history. Her history is she breaks bones. So now whenever she, I always know when she breaks a bone. She's a young adult now. But the other decision is, my daughter and I were in a very serious car accident, and she was on the passenger side. We were broadsided, and she was the one that was impacted greatly. first responders actually thought they were, and they told me later they came up, they thought the passenger would have been dead. And so that's how bad it was. Long story short, she had a comminuted, and you can correct my pronunciation on that, femur, and which is the bone in your upper leg. I'm not correcting or telling Dr. Hoffinger, I'm telling our viewers that. And we had a choice of either an internal rod put into her leg or an X-fix. And an X-fix is an external fixator, which is like a cage. And because we help patients and customers like that in my business, CastCoverz, I knew what it would entail for her. Plus, I knew she wanted to go to college in 3 months. Her high school graduation was just in 2 weeks. So we made the decision of an internal leg rod. And of course, it was done in a traumatic aspect very quickly. And so she does have a little bit of leg length discrepancy. I still don't think I would have chosen an X-fix because it would have got the healing would have taken so long. But those are the questions and the choices that sometimes parents have to make. And
yeah. And so let's say we get to another option of we're going to operate and we're going to put a pin in it.
Mm-hmm.
Or sometimes a pin or a plate. It's like, what's the advantage of one or the other?
Right.
And I think it's a very fair question to say, what would you do for a family member?
Yes.
And I've always answered that one that, this isn't always a valid answer because I would do different things for my kids. I would operate on my kids I used to joke in a heartbeat just to pay them back, but I operate on the kids because I'm not afraid of surgery. I see good things with surgery all the time. I might opt for surgery because I think it has an advantage of faster,
Mm-hmm.
less time, but the more conservative approach, less surgical, is preferred. But balancing those two, it's like, well, we can put you in a cast, it'll heal, or we can operate on you and it'll heal. Well, which do you think is better? And then which would you do for a family member?
Mm-hmm.
And now at this point, just with 2 questions, you now know benefits of both, disadvantages of both, and my personal preference. Another question further down the line is there any other option that we haven't considered? When people talk about getting another opinion, I've had people ask me that, and I always think that that's a very good question to ask, like, would it be helpful if we got another opinion? Because there's times where, no, there's no choice for this, and you may or may not take my word for it. Or, that's not a bad idea, but let me give you the names of some people. And I think that's helpful because if you go to another person who I think is not any better than me, it's not helpful. Now, I may be quite arrogant in that, but considering that, I'm going to give you the names of people, not who will agree with me, not who will agree. We are used to disagreeing in conference all the time. I'm going to give you names of people who, if they have a different plan, I'm going to think, really? And I used to do this all the time with one guy, like he almost always had a different plan than me. And I told people, he have a different plan because he just does. And we'll be able to talk about, you and I, which we think is better. And it was like, really, he do it that way? I wouldn't have thought about doing that. But that's helpful. A second opinion should either confirm or provide helpful information as opposed to someone who just, in our mind, is less skilled and less special in this field.
I also believe very strongly that a patient needs to have faith in their doctor and their medical team. I know research has indicated that if you do, your healing is speedier and recovery is probably more advanced. The important thing, I think, for a patient when they see a doctor is that they have a good feeling, a good vibe, good instinct, instinctual gut reaction. And if they don't, I really encourage you to go find somebody else that you can relate to. What would you say about that?
Absolutely. We're starting a journey and we have to have faith in each other. Now, you don't always have that choice. You're in a car accident, got a femur fracture. You don't always have a choice in those things. Later on, you do. But especially with something that's a little more elective, you want to know, I feel good about this. I feel good. And it could be, I feel good. One of my positions I worked for a long time, we had a nurse who'd been doing it a long time. And he was fantastic. And he didn't give people long answers to things, but he was available and he always answered their questions. And people really liked getting to him. They liked being able to have
comforting. Yes, very comforting.
The office, the scheduling staff, the nursing team. Now we have a lot of nurse practitioners and PAs. Feel that you're important. Feel that we care about you, because we should. And you should feel that, not that you're a nuisance, like, oh,
right. And that's, sadly, sometimes that does happen. And if you're in a position where you can find somebody else, not obviously an emergency situation, but if you can on any type of surgery, and typically, wouldn't you agree that a standard fracture, if it requires surgery, could actually, unless it's an emergency situation, you could actually go see somebody else in a day or two. Would you agree with that?
Yeah, that's a really good point. Like, one question I was going to say, when you're 10 days later, you come in with a broken finger. And I always tell the physicians and pediatricians when we give talks that it's broken today, it's broken tomorrow. and I'm not going to, for most things, I'm not going to get you on the OR schedule the same day. And if I do, it's often a scheduling thing, because you're going to be an added case today or tomorrow or the next day. It doesn't matter when I'm going to add you. It depends on when I want to miss dinner. And so you do have a lot more time than you realize. You absolutely do. It doesn't. And in fact, if someone says we should get at this right away, I would ask why.
Oh, good question.
I would ask why. I found that with sports surgery, there was a time where the ACL surgeons all competed for it. So they would say, well, and they said, well, we saw Dr. So-and-so who said she could get us in tomorrow. Doesn't make her any better. It just means she's got a spot in her schedule, And then we found that delaying ACL surgery was better than urgent ACL surgery. So you have. So
you want to speak on that a little bit while you're on? Why did you find that out about ACL surgery? Because lots of people have ACL injuries.
So when I was a medical student a long time ago, I was at Michigan, and when they would have a football player who ruptured their ACL, I volunteered to come in on the weekend and just hold their big giant football leg while they operated on it.
Oh, really? Okay.
And I mean, their leg was all big and swollen, and we didn't do it with arthroscopy then. That had just been worked on at the time. And the problem we found a lot was the patients had a lot of stiffness afterwards. And we just thought it's because they injured their leg and they had stiffness and had surgery. And then as time went on, people found that if you rupture your ACL, your leg's not going to fall off. So at the very minimum, if you use crutches and work on your range of motion, the swelling goes down, the bleeding into the joint goes away. And now you have a knee that's in very good shape. It's just missing an ACL, as opposed to a knee that's swollen, stiff, painful, and missing an ACL, which you then assault with an operation. So there are times where delay is preferable, and the flip side, more commonly where urgent, emergent, other than certain fractures, no. I mean, you broke your arm today. I mean, and it's Friday. I can operate on you Monday, Tuesday, Wednesday.
Right. With the case of my daughter, she loves at family events to hold up her hand and show her crooked pinky. She loves to do that. And you didn't
do anything wrong as a parent, by the way. If you ran to the doctor every time your kid got hurt, which you do for your first kid. First kid, you're always, you say, we tell our kids, we like the first one, but you're practicing with the first one. Right. And by the last one, you're like, is it bleeding? How much? Is like a lot of blood or a really lot of blood? So, that's the first parent thing. But you haven't done anything wrong. You'll feel bad, but you haven't done anything wrong. And that's a valid question too. Did I do anything wrong by waiting? Right.
The ones that we get often are, if they call and we get a chance to talk to them, well, how did this happen? And you could, sometimes it's dad was playing and they were jumping on the bed and he fell off. That'll happen.
That's another thing. So in maximizing your time with the physician, how did it happen? Yeah. Well,
Yes.
someone said I asked my daughter to explain the last Veggie Tales show, and 2 days later she's still telling me. You know?
Yeah. So that's a very good point, because would you agree that the doctor it needs to know just basics, like fell off the bed, fell off a 6-foot ladder, car wreck, some very basics. They don't need to know all the nuances about it.
And if we do, we'll ask.
Yeah.
It was a car accident where you
There you
passed
go, trauma right there.
or I was hit by a car. I fell off monkey bars. Monkey bars is huge for us. So
Yeah.
it's just, well, I was on that monkey bars. That's it. Monkey bars. Jumping on the bed. Yeah, it's low energy or high energy injury.
Mm-hmm.
And the reason I point that out is that, you want to maximize your time. So how did it happen? Monkey bars. And then, we'll just chat about that and take a look at the x-ray. Or, the leg's been growing crooked and I want to take a look, and we just noticed it. And then you get your x-ray and you take a look at that. Because, as I say, you want to maximize your time. And so your questions, what are our options? Is there anything else that makes sense? How urgent do we need to do this? What else? What might you recommend if there are choices, for your family member, or would you do this for a family member? If yes or no, what other options would you do? It's also fair. I've had a number of families ask me, what am I not asking? I think that's a brilliant question.
That's a very good question.
Along with the lines of, if you're not sure what to ask, you say, well, I'm worried about this. What am I not asking? The great thing about that is that itself is a trusting question. I'm trusting you to bring out the most important things. And there's times like, well, you haven't asked me if there's any other option, or you haven't asked me, if she'll be back to 100% or 95%. And as opposed to things that I don't think are worth the time. Don't ask me how many stitches you're gonna take, because I don't know, I'll make it up. I don't know. 11B4.
I wanted to say that. Do you make it up? But
all the time,
because it's who knows?
I don't know till we're done.
Right.
We often weave a stitch through, so it could be one, like a whole sweater. It's one stitch, and if you want to maximize your time, you want to maximize the time, because eventually, we do that walk into the door thing. Yes. I'll start walking like, okay. And we start walking, and that's why I always make sure that no one's between us and the door. I'm sorry, I'm being realistic here, because we want to answer your questions, but let's maximize our time. You're going to have to balance, as doctors, you must balance your time versus the care and concern for the patient, because if the patient doesn't feel valued and cared for and listened to, they're not going to feel good about it. And so it is an art and a science, I'm sure, when you're meeting with the patient, especially if you have a parent or two parents in the room and a child, and it's their first time of a broken bone, and they think it's it's not. I will tell you this, as the mother of somebody who's broken 22 bones, it's very sad and very hard to watch your child in pain. It is concerning. But a broken bone makes a great holiday card, without a doubt. And so when I share that, like on calls with our customers, they're like, "Oh, you're right." Yes, there are so many other worse things that could happen. And you should have, the physician, the surgeon also has people in the office. So when you get a cast on, the cast orthopedic technician should also be able to explain this. And this has been shown in some studies that if the rest of the team provides valuable information and confirmatory information, like doctor said, we can't get a waterproof cast. You ask the cast tech, like, so why can't we get a waterproof cast? And I've had times where they say, well, I don't know, let me check. And they'll check and they go, yeah, actually, I guess you can. Or you should feel free to ask the cast tech about that. Our nurses are a critical part. As you're checking out, things come to you. Ask them. We have to make an appointment in a week. Can you check to see if she can go on her field trip tomorrow? And there should be a way in the office to ask questions. Now electronically, my chart and things like that are really very helpful. But you should be able to on the way, the rest of the visit, get further questions answered, so it doesn't all have to be in that one room.
And that's another, because sometimes we have to gather our thoughts, as you said, just as you're walking out, and it's like, oh, I forgot to ask this question. And having those touch points in an office is important. My mother has Parkinson's, and she's in a wheelchair pretty much now. And the doctor is phenomenal, spends time with her, answers her questions, but his staff is awful. And I don't know if he, we've said, nobody called us back or this, and he'll just, okay, Sally, now let's take care of you. And so she just thinks he's the greatest. My sister and I are like, oh my gosh. So it is part of the whole experience for a patient and if the doctor is giving you the information and you still get that feeling of being cared for and listened to all the way through, it's such a positive experience.
Yeah, it brings up a good point. As much as we don't want to hear it, if there are issues with the office, don't kill us with it, but we got to know.
Yes. Yes. Oh, it's important. It's just like,
person was rude. I was put on hold. How many times people said that the phone tree didn't work, and I told the administrators, and they would say, yeah, it does. Like, yeah, this mom making this stuff up all the time because she'd rather come on. The feedback you give us is important. And it's really nice just to get it in a casual way, only because if people write letters, it will go often to people that are not associated with it, with other people. At the first step, just let us know. It's really hard to get a message to you.
Yes.
No one gets back to me.
I think clarity and being succinct in that case is very important. Just to, hey, by the way, I just want you to know that was having difficulty with the phone tree. You might want to check that out.
We need to know. We don't want to know it, but we need.
Yeah. Well, it's just like in my company, I need to make sure that my customer service team is taking care of the customers. And if they're not, I need to know about that because that makes an impact. It's the same.
Confident. As we said, it all goes back to feeling confident in the physician and the surgeon physician's team, because, like I've said, we are joint decision making, and that means is back and forth.
Yes. Yes, absolutely. So some of the things that you talked about, let's just review them to ask, which I think is great. What are you concerned about? So bring to the table, bring literally and figuratively in the exam room, what are you concerned about? If you're not sure what to ask that question. You want to ask, are there alternatives? Are there options? And you might want to ask, why? Why are we having this method of protection and healing? You want to also bring to mind anything else that you might want to, but always make it clear and succinct. And try as hard as you can not to give all the details of the break. I know it's very tempting to do that, but this way, if you just give the basic details of why you're in that office, the doctor can get to you much more quickly and help you much more quickly. Your girlfriends and your friends and the golf course are the reason. That's when you can spin the story. And I had a customer, and I loved it when I found out. And so, how did you break your bone, or what, whatever happened, And one of them that I have many, many stories, of course, but one of them I remember, she said, I want to say jumping out of a hot air balloon, but I can't. And I said, oh, okay. She said, I just tripped on my dog's food bowl. She wanted something elaborate. So I thought that was a very funny story.
Yeah, I always like the one where dad was playing, and you mentioned this, dad was playing with the child and threw him or her on the bed, and then threw a little bit too long and went over the bed.
Yes.
Mom but I'd admit it. I said, yeah, I've done that.
Yep. Yeah. Yeah. I mean, it happens. That's the actual definition of an accident. You can't plan it. You don't know it. It just happens.
Yeah. Unfortunately, the good thing about orthopedics is most of the stuff we can get you back to 100%.
Yeah. And actually that'll, in closing, I would love to add that when you do have an orthopedic injury of any kind and you have a device, you have to understand that your body is healing, that you have to respect that process. And you may not be able to do everything 100%. You may not be able to swim in that pool in Hawaii, but you could still do other things. And then just understand that's just health always takes precedence. In our family, sadly, that was always the case. Okay, we've got this planned, but we never know. With Ellie, we just never knew. After a while, we just said, never know. And so health is, and it just adds to the story of your life. So it's not the end of the world. It just adds to the story.
I wanted to ask you, I never asked this one. We'll do it right here online. When did they investigate you for child abuse?
Yeah, they never did. And you know what they told me? Number one, I was good friends with the doctor, pediatrician. So he had been to our house, so he knew us. I was very dear friends with the sheriff. So he'd been to the house and he knew us. And they also, though, told me, it was like the third or fourth break, that they can kind of, which I did not know this, you can correct me if I'm wrong, but they told me they can kind of tell if it's an abusive situation or if it's truly an accident. Okay. So I didn't know that world even existed. Nobody ever did. And of course she ended up going away to college to Auburn. She ended up breaking another, I don't know, 6 or 7 that I know of. And so she's just, no, we never did. And they never took her separately either. You know how they do that?
Yeah, it's usually, yeah, you're right. There are patterns, littler kids. I've actually had one family of twins, and they had enough breaks when they were really little girls, month to 5 months old, that I told mom, don't go to the ER anymore. Come here because we need to look to you for brittle bone disease.
Yes.
And that's what they had. And
they did.
Yeah. Yeah.
See, my daughter was tested and she didn't.
Yeah. And it was just because, the ER has to do that. Might as well put a plug for that. We have to over investigate for this.
Yes.
And it's the thought that someone would accuse you or take your child is crushing and devastating as a parent. We have to over ask and over investigate. And just wanted to mention that since we did bring up
well, it was really funny. The second time she broke her bone, she was under 2. So it was second before she was 2. She came up to me, she just looked at me and she said, and we called our doctor, her doctor, Dr. Bruce. And so she came up to me and she patted her arm and she said, no, Dr. Bruce. What did you do? And so the first 2, her big brother, were playing. They were, and so she would walk into Dr. Bruce's office and say, Max, and Max was only 19 months older. I mean, it was just, they were just playing, but she just obviously, she has some type of condition. They just don't have a test for. We believe she doesn't have a certain cross fiber in a bone. They just don't have the test for. So, so she just has to be careful. She played soccer. She had a full life. She has a full life, but it is, cute.
I love hearing what kids say, their impressions.
Oh yeah. Max. Yes. And then of course he has stories about her. How many times we had to take her to the hospital? How many times he had to do stuff to hold her arm or her leg? He never became a doctor. He's going to be a lawyer. So anyway, all right. So anything else you'd like to add as we close? No.
I hope people get the information from this. I really want this. We want this. We encourage this.
Yeah. Well, thank you. And again, I think just so people understand, doctors, orthopedic surgeons, and other specialists are there for a reason, to help. That's it. I mean, and so give them the opportunity to help you and let them treat you properly. Awesome. Oh, that's a question that they could say. How can I help heal? That's one thing that they could do is, what can I do to help heal this process?
Excellent. Very good point.
And then have the doctor share, don't do, whatever it is.
Yep.
Okay, great. Well, thank you very much. And we'll see you on the next Ask the Ortho.
Great. Thanks.
Okay. Thank you.